only the company's current beliefs, expectations, and assumptions, but actual results, performance, or achievements of the company may differ materially. These statements are subject to known and unknown risks and uncertainties, and we refer you to our SEC filings for more details on these risks, including the company's most recent annual report on Form 20-F. The company undertakes no obligation to update projections and forward-looking statements in the future. And with that, I'll turn the call over to Anat.
Thank you, Yvonne, and a warm welcome to everyone joining our call today. Today marks my last quarterly call as President and CEO of Compugen, and I could not be prouder or more confident as I pass the leadership reins into the exceptional hands of Eran. I'm excited at the opportunity to take on the newly created position of Executive Chair, where my focus will be on Compugen's corporate strategy and strategic collaborations. We believe this leadership combination provides a strong foundation for the company's next phase of growth. Before I provide an update on our progress in this quarter, I'd like to first share some high-level reflections on the current landscape and why we believe Compugen is well-positioned for future growth. Immunotherapy has been tremendously successful and is extending the lives of many cancer patients, with Keytruda standing out as the top-selling drug. However, significant unmet medical needs persist, with many patients still lacking effective treatment options. As a result, we're seeing a shift in how immunotherapy is being approached, driven by a focus on novel mechanisms of action, innovative combinations, and new modalities aimed at enhancing efficacy and safety across multiple cancer types. This is precisely where Compugen's differentiated approach aims to create significant value. We're leveraging Unigen, a validated AI/ML-powered computational target discovery platform, to identify novel mechanisms to activate the immune system against cancer. In addition, we're advancing our pipeline of differentiated immuno-oncology therapies with the goal to transform patient outcomes and deliver meaningful clinical and commercial impact. In the clinic, we have our potential first-in-class immune checkpoint inhibitor, COM701, in addition to validating partnerships with the potential for a total of over $1 billion in milestone payments and tiered royalties on future sales, with both AstraZeneca on bispecific rilvegostomig and Gilead on anti-IL-18 binding protein GS0321. We have a solid balance sheet with $93.9 million in cash at the end of June 2025 and expected cash runway into 2027. With our leadership expansion, a strategically differentiated pipeline, and operational focus, we believe that Compugen is well-positioned to capitalize on potential growth opportunities ahead. Now, turning to the progress we have made this quarter. We continue to advance our immuno-oncology clinical and early-stage pipeline programs, starting with our potential first-in-class anti-PVRIG antibody COM701. The first patient was dosed in MAIA-ovarian, our maintenance immunotherapy trial in platinum-sensitive ovarian cancer. We continue to make progress opening sites across the US and Israel, and we aim to share interim analysis from this sub-trial in the second half of 2026. As a reminder, this is the first sub-trial of our adaptive platform trial, comparing COM701 maintenance therapy to placebo in 60 patients with relapsed platinum-sensitive ovarian cancer. There is an unmet medical need with no standard of care treatment options for this patient population, progressing post-PARP inhibitors and/or bevacizumab, or who are not candidates for such treatments. We have observed increased competition in this space, primarily from drug candidates evaluated in the platinum-resistant ovarian cancer setting. This reflects the recognized and significant need to improve treatment options for these patients. In this earlier stage population, platinum-sensitive ovarian cancer, safety becomes an even more critical consideration along with efficacy, which in the maintenance setting aims specifically on delaying time to disease progression. We believe that advancing COM701 in the maintenance setting of platinum-sensitive ovarian cancer represents a compelling opportunity to demonstrate its potential advantage in terms of durability of response and tolerability. As previously communicated, we view a 3-month improvement over the median progression-free survival of the placebo as clinically meaningful. Positive data from this trial could support a broader clinical development program aimed at addressing a significant unmet medical need. At ESMO this year, we plan to present a pooled analysis of our 3 previously reported phase 1 trials reflecting clinical benefits of COM701 as monotherapy and in combination in patients with heavily pretreated platinum-resistant ovarian cancer. These data form part of our rationale to advance COM701 in our ongoing platinum-sensitive ovarian cancer adaptive platform trial. Moving next to the TIGIT landscape. Despite failures in the TIGIT space, it is notable that some companies